Hi, I'm Dr. Sabalbal, a vascular surgeon and a minimally invasive vein specialist. I treat a variety of problems related to blood vessels, including advanced treatment techniques for varicose veins. In order to accurately and properly treat your venous disease, a detailed vein ultrasound is done prior to your appointment. After a thorough history and physical examination, treatment options are recommended based on your quality of life, symptom severity, and ultrasound findings. One of the treatment options is a modern and relatively painless technique to close diseased veins with a medical adhesive known as VenaSeal. VenaSeal uses a medical glue to close affected veins, which then redirects the blood to healthy veins. Because varicose veins don't always appear on the skin's surface, ultrasound is used to map the veins needing treatment. Using just 1 or 2 needle pricks to freeze the skin, the diseased vein is entered with a wire and catheter, and the glue is applied under ultrasound guidance. Since there is no heat or laser, you won't feel any pain, and you are back to work the next day. At the start of the VenaSeal procedure, this is a typical setup. The patient comfortably reclined, the legs somewhat dependent to allow the veins to engorge a little bit. And the first step is to use the ultrasound probe and scan the vein up and down the predetermined access site. So as you can see on the ultrasound machine, there are multiple circles with what seems as black filled fluid inside. Those are his veins. You can see the multiple sizes. If I push on it, it compresses somewhat. So this is actually a saphenous vein in the middle, and you can see a bigger vein here. This is a big branch coming off a deep vein called a perforator vein that will hopefully be closing once we glue past its junction with what appears to be a posterior tibial vein. So access will be, the nice thing about VenaSeal is you can gain access at the ankle and treat the vein all the way up to the groin versus something like laser or radiofrequency ablation, where normally it's not recommended to treat below the knee due to a possible trauma to the saphenous nerve. So with a very small 21 gauge needle, we gain access into the saphenous vein. You can see that black circle in the middle of your screen. That's the vein. You can see little white speckles inside. That's actually the blood flowing up the leg. Now we go in with the needle. And you want to always find your needle tip with the ultrasound. So action there. You can see the white dot inside the vein. That's my needle tip. You can see blood dripping back from the needle. That confirms that I'm inside the vein. We then use this small 018 wire that comes with the set. And we establish wire access into the vein. Okay, and I confirm with ultrasound that my wire is in. To the sagittal view. You can see a white line inside the vein. Once we establish needle access, we use a small 11 blade just to make a small nick in the skin to accommodate the size of the VenaSeal sheath, which is 6 French, which is about 3 millimeters, 2 or 3 millimeters in maximal diameter. So we only need a few millimeters of an incision, which makes this very aesthetically appealing. So once we make the small incision, we advance a 5 French sheath over the wire. That will help us then navigate the next step of the procedure, which would be to get a bit of a bigger wire into the sheath and up into the groin. So the VenaSeal comes with the following. This is the actual VenaSeal sheath, the 6 French, that goes inside the vein over what we call a Benson wire. This is a wire here. It's got a floppy tip so it doesn't traumatize the vein as it goes inside. And then this is the actual adhesive, the VenaSeal adhesive, the glue. It's cyanoacrylate. Once it goes inside the vein, it polymerizes with the blood and it causes almost immediate stagnation of flow, which is what we're after. This is the delivery mechanism that connects to this syringe, which then connects to the delivery catheter. So this catheter, as we'll see later, we will prime it with the VenaSeal adhesive, which then goes inside the sheath, which then goes inside the vein. Now we are sending the Benson wire up. So if you watch the screen carefully, you'll see the wire coming up into the groin, and if you, there it is. You see this white structure here that's moving. That's the actual wire. Now we're at what's called the saphenofemoral junction. You can see a vein branch coming off this way. This is what's called the medial accessory saphenous vein. And now the wire is now actually up the common femoral vein and going up into his pelvis. So once our wire is up into the groin, this 5 French sheath is removed. It's done its job. We'll pressure the ankle here to make sure there's no blood loss. And then we exchange it for this VenaSeal sheath. You can see the tip of the VenaSeal sheath. Inside it is the dilator. And that dilator will come out once we've positioned it where we want. So now I'm sending the VenaSeal sheath over the wire. You always want to make sure that you see the tip of the wire on the other end. A little bit of pressure here as we're sending up the sheath. Okay, and then we're watching the ultrasound. You can see the actual sheath getting close to the junction. So once we've positioned the sheath at the saphenofemoral junction, the gray dilator piece is removed. And there will be some venous back bleeding into the sheath. We plug up. We flush and pressurize the sheath. And then we always want to, anytime anything comes out of the patient, you want to make sure you flush it so that the blood doesn't clot inside the actual sheath or dilator, like so. And now we proceed with priming the VenaSeal catheter. So the VenaSeal kit comes with this small syringe and priming needle. It's a 3 milliliter syringe, and the VenaSeal adhesive is drawn up into the syringe. So what we're doing now is we're priming the catheter with the adhesive. There's a small black dot that at the end, close to the end of the catheter. That's a laser engraved marking that tells me when I've reached the end of the priming. Okay, so now the VenaSeal, the adhesive primed catheter is advanced into the sheath. We're watching the ultrasound, and we want to make sure that we start counting from the tip of the actual catheter. So you can, our next step now is to find the tip of the catheter. So I'm going to move this adhesive back. There it is. Yeah, so there's the tip of the catheter there. Right at the saphenofemoral junction. And we want to be a safe 5 centimeter distance away. So we count 5 centimeters. 1, 2, 3, 4, 5. Let me advance it. Okay, good. So we see the junction is now free of the catheter. It's compressible. Good. And now we can start with one more. Now we can start with gluing. So we've just delivered the first aliquot of the glue to seal off the saphenophymal junction. Now you have to wait 3 minutes to safely allow the adhesive to polymerize in the blood vessel to prevent any dislodgement up into the deep veins or the more important veins. And then we mark our distances with these markers that come with the catheter. So each black dot is separated by 1 centimeter. And each time we deliver an aliquot of the glue, we move the actual sheath 3 centimeters back, inject, wait 30 seconds, move 3 centimeters back, inject, wait 30 seconds, so on and so forth until the entire vein is sealed to its entry point near the ankle here. We're at the end of the procedure now. So you can see there's still the clear part of the catheter, which protrudes 5 centimeters from the end of the sheath, which means that we can still deliver 1 aliquot of the adhesive into the leg. Hold it for 3 seconds, and release. And then we can disconnect from the syringe, advance the sheath back over the catheter so that there's no glue deposited outside the vein. And the glue comes out. Thank you. And we put some pressure on the site for a few minutes. And then we check with the ultrasound to make sure that everything's closed up. So at the end of it all, we have a small incision near the ankle. And the entire great saphenous vein has been sealed from the ankle all the way up to the groin. So after the procedure is done, our general advice to the patients is to walk around the facility for about 15 minutes. Number 1, to make sure that the patient feels okay. And number 2 is to promote some recirculation in the leg and help prevent a deep venous thrombosis. We also tell the patients that for the first few days after the procedure, they may experience some burning, some irritation, a little bit of itching maybe underneath the skin where the vein was accessed, and anywhere along the vein where it gets close to the skin. That is often treated with some ice packs, some Voltaren gel, and it self-resolves within 2 or 3 weeks. We ask them to wear their compression socks for 48 hours straight after the procedure, and then for 2 weeks thereafter, just during the day, and then they can remove their compression stockings if there's no accompanying problems in their other veins. And then I see them back in a week for a post-procedure ultrasound, and then again in a month for another post-procedure ultrasound to make sure that everything was technically successful and that there's no evidence of any clot in the deep veins. Please contact our office to see if VenaSeal might work for you.